Hi, I'm Brittany Montez, and this is the Orlando Health News Review for June 12th. The early morning hours of June 12, 2016 will be forever remembered as a defining moment in the history of Orlando Health when our physicians and team members rose up amid tragedy to serve our community. On this 8th anniversary, we remember the 49 lives that were taken too soon, the families and survivors who continue to heal, and all of those who answered the call for help who are forever changed. And the 8th annual Community Rainbow Run presented by Orlando Health was held last weekend at Orlando City Hall Plaza. The 4.9K race honors those who lost their lives, the survivors, their families, first responders, and all of those impacted by the Pulse tragedy. And summer travel is expected to hit records this year, which means more families are likely planning to enjoy plenty of water activities. Orlando Health worked with news outlets around the country to share the ABCs of water safety. Since May 2nd, Dr. Plumley has appeared 224 times in 94 of the 210 U.S. TV markets. His story of the ABCs of water safety for children has appeared in online news outlets that average 340 million visitors per month and has reached nearly 25 million people through traditional radio and television news.
Really, the number one thing is adult supervision. We kind of try to teach families, and we do work in the community with the ABCs of drowning. It's simple to remember. A is adult supervision. You always need to have someone watching children. You should never be an arm's length away from a child in a tub. You should never leave a child unobserved for 15 seconds. B would be barriers, fence around the pool, locks on the doors, alarms. So some kind of barrier method to alert you or to prevent the child from getting in the pool. And then the last is classes, that both for the adult and the child, the children should have swim classes and adults should learn CPR, because both those will help improve the outcome of a drown.
And on October 1st, we kicked off a new fiscal year and introduced this year's performance goal for team members, attaining the 64th percentile ranking on the HCAHPS survey question, would you recommend this hospital to your friends and family? This question serves as a crucial indicator in our patient surveys, reflecting the overall perception of the safety, quality, and consistency of care we provide.
We kicked off our measurement period on April 1st. And we've had a really strong start across the system. Preliminary for April and May, Orlando Health is currently at the 71st percentile. With this being one of our performance goals, we will be able to achieve up to $1,000 in an incentive payoff if Orlando Health can meet this goal. What our patients have told us across the system resoundingly is that they need to feel better connected to their care. And we know that we can achieve that by focusing in on working together as a team and making sure that we communicate well with the patients so that they understand what's happening while they're in our hospitals. If we can focus on that, Orlando Health will supersede what they're trying to achieve this year.
And here are a few dates to know. Check out Swift for all the details. That's it for today's edition of the Orlando Health News Review. We'll see you next week.